Good morning. My name is Janet Thurston. The following presentation is an analysis of health information technology issues, and I have chosen to address the combination of a legislative issue and an ethical issue. The first concern will be to review the legislative implementation of the Meaningful Use Program and to discuss its impact. The second issue is regarding the ethics of nurse practitioners attesting to or being engaged in the MU or Meaningful Use Program and its implications. An outline of the presentation is as follows. I will identify and present the issues of concern, reviewing the background information on them, examining the legislative and healthcare delivery of them, which is to address the Meaningful Use Program and nurse practitioner attestation of it. I will then summarize the presentation with potential strategies for future success in healthcare. The objectives for this presentation include the following: to summarize a legislative and an ethical issue related to health information technology utilization. We'll describe the current status of meaningful use and nurse practitioner meaningful use or MU attestation. We will describe the current status of nurse practitioner or NP and meaningful use or MU health information technology issues locally, statewide, and nationally. We will state the significance of a nurse practitioner or NP and meaningful use MU EHR electronic health record utilization statewide and nationally. We will now identify and present the issues of concern, which are legislative and ethical. The legislative concern is the Meaningful Use Program, which was put into action in 2009 when President Obama signed the Health Information Technology for Economic and Clinical Health, also known as the HITECH Act, as part of the American Recovery and Reinvestment Act, or ARRA. HITECH is now directed by the Office of the National Coordinator, ONC. The goal of this act is primarily to improve healthcare outcomes through the use of electronic health records in healthcare settings. It is primarily intended to increase patient safety, improve outcomes, and reduce costs, specifically for Medicare and Medicaid recipients. The HITECH Act offers financial incentives for eligible providers to financially support them to implement the use of EHRs. To receive an EHR incentive payment, providers have to show that they are meaningfully using their EHRs by meeting thresholds for a number of practice objectives. The beginning of the Meaningful Use Incentive Program began in 2011. The Center for Medicare and Medicaid Services, or CMS, began by coordinating financial incentives for those who participated in the program, meeting criteria defined as meaningful use. The Centers for Medicare and Medicaid Services are now implementing this program for Medicare and Medicaid eligible providers. As EHR implementation and meaningful use programs grow, it is important for the nurse practitioner to be aware of this meaningful use program. They are eligible providers who can receive incentive funding as Medicaid providers. The ethical issues to be reviewed are related to nurse practitioner MU attestation. Why is this important? Because nurse practitioner data on EHR or MU utilization is limited. Nurse practitioners are commonly Medicaid providers and are eligible to receive incentive funding. Data collection is needed particularly for independent practicing nurse practitioners who own and operate their own clinical facilities. There is incentive to help them adopt EHRs. When information is available to locate where they are, who they are, and how they perform, that information would be helpful to others. Physician and NP groups have data reports and they are often bundled to providers in reports. NPs become invisible in many data reports. Information is being withheld if provider groups are bundled together. NP outcomes are unknown, as their outcomes of clinical measurement standards within the MU program are unknown. This has been the author's experience in many attempts in literature searches or in personal institutional investigations. Is this invisibility self-directed, or is it because NPs are not participating in decision-making related to EHR utilization or MU reports on outcomes of the care they provide or the quality? This is a question I ask. Background information regarding MU is complex, and more information to review in detail. It is best to visit the website www.hit.gov. I recently published a document that provides extensive information regarding this program with much more detail on it. Briefly, in MU attestation, providing proof that you use your EHR in a clinically sound manner, providing various quality items are examined, for example, use of e-prescribing. The criteria are detailed related to clinical care and outcomes, which follow evidence-based practice. According to the Quality Forum, a group of clinical experts, they selected clinical quality measures in the MU program to support EHR systems that provide quality care while maintaining privacy and security of EHR systems. The incentive process promotes and supports the adoption of health information technology by the healthcare industry, by healthcare providers, consumers, and patients. To receive an EHR incentive payment, providers have to show they are meaningfully using their EHRs by meeting these thresholds for a number of objectives. And if you would like more information, I have posted the National Quality Forum information and website on the PowerPoint presentation. The background information regarding meaningful use includes knowing that Medicare and Medicaid EHR incentive programs are staged in steps with increasing requirements for participation. The graph describes the 3 stages of attestation as it occurs between 2011 and will continue into 2016. The first state of implementation attestation of MU began in 2011 with simple EHR utilization to be demonstrated, such as e-prescribing, providing clinical summaries of the visit to patients. This is a brief paper-based document a provider gives to a patient at the end of the visit to summarize plans for care and communicate a collaborative relationship with patients. The second stage of attestation expands examining clinical quality measures, such as can patients access their records, obtain refills electronically, and share data, and so forth. The Stage 3 issues that are anticipated will focus heavily on concepts of incorporating interoperability into the EHR use, which would be needed for accessing patient data at the point of care and for demonstration of patient population outcomes and improvements. Now let's turn our thoughts to the nurse practitioner engagement with the MU program. Let's look at the background information on nurse practitioner attestation. I attempted to determine the number of NPs who are using EHRs, and with MU attestation, the information I found was the following. According to the ANA, as of July 2012, the MU incentive recipients included 8,722 NPs and 1,099 CNMs, and the total award amount funding was $2,006 million and some added dollars. The report did not provide information on independent versus dependent nurse practitioner practice. I contacted the National CMS Medicare Medicaid office to inquire on this. Can I obtain data on NPs in independent practice? Their data presents had bundled providers. How can an independent NP be bundled into MD practices? I was advised to contact each state to collect this information, as each state administers their own Medicare and Medicaid program. The state-by-state programs did not keep data such as this, according to discussions I had with Montana Medicare and Medicaid offices. Nearly 1/4, or 22%, of more than 35,000 primary care nurse practitioners in the United States work in rural areas, and many are independent providers. According to the literature, it would be good information to know, as they may need support for EHR use, being isolated in small independent practices, providing care for people who might not otherwise obtain it. It is ethical to have information on NP EHR utilization and MU attestation. They are significant providers in healthcare delivery systems throughout the country, particular to disparate populations. This should be considered at local, state, and national levels. There are 851 active physicians in the United States, and approximately 6,097 2004 are using EHR, according to the Kaiser Family Foundation in 2014. The data on how many physicians are engaged in MU exceeds 250,000. That means approximately 27% or more are testing to MU today. Now consider if there are 233 NPs in the United States, and there are 171,511 of NPs not attesting to MU in 2012, according to the ANA report. That would mean that 95% of NPs are not attesting. The question needs further investigation. This is the ethical issue for NP practice. For more information on the background, nurse practitioner attestation. The title of this story is Doctors and Hospitals' Use of HIT that more than doubles since 2012. The graph on the slide of this article notes over 250,000 physicians and other providers achieving stands for MU incentives. There are over 250,000 physicians and others achieving MU, and there are only 8,722 NPs according to ANA. Again, 78% ambulatory care MDs are participating in MU and only 5% of NPs are. My mathematical analysis must be incorrect. How can we really know accurate information? That is an ethical issue. The invisibility of data collection regarding NP practice in EHR use and MU attestation needs more reflection. Invisibility is not what NPs need or want. Let's take a look at this from the quality improvement perspective. What quality reports representing NP practice are available? Do all reports bundle MDs and NPs practice outcomes? Who is creating quality reports for attestation? What do they report? These are questions I ask NPs and CNMs in all kinds of practice, and that DNPs may participate in this as the frontline effort in the future. Legislation community significance includes the following. Missoula EHR county adoption rates of EHRs was 33%. The number of providers using EHR is 398. There was no data available on provider MU attestation. Although MU payments made in Missoula County were noted to be 78 payments, there has been no data available on Missoula NP's use of EHRs or MU attestation. When we look at the legislative issues on these concerns, on the state level in Montana, EHR adoption is approximately 36%, with providers attesting to MU at 27%.